The heroes in this war against COVID-19 have been the healthcare workers serving on the front lines.
Tonight, as Tennessee attempts to rebound from the shutdown of our state's economy, we hear from a doctor and nurse who became casualties of that war.
They spoke exclusively to News Channel 5 Chief Investigative Reporter Phil Williams. Phil?
Well, guys, they agreed to share their story because they fear that too many Tennesseans, in their eagerness to get back to work, still do not fully appreciate the enemy we face. It's an enemy they've seen up close.
It was an emotional roller coaster for sure.
On the front lines of the battle against COVID-19, the caregivers know sometimes there's not much that stands between them and their patients.
And so it was like, I have that same virus that I've seen people be on ventilators for. I've seen people struggle to breathe.
Nurse Samantha Queen became a patient herself.
I mean, I kind of went into the whole thing expecting to get it at some point.
As did Dr. Matt King. After the emergency evacuation of a Gallatin nursing home, King's job inside Sumner Regional's ICU had been to save as many lives as possible.
We suddenly had 100 new patients in the hospital that were all COVID-19 positive.
He sent his wife and children away to relatives to avoid the risk to them.
We talked about several different things we could do here at the house to keep me isolated, but I just knew that would break down at some point.
And when he got a few days off,
suited up, 6:30 in the morning, getting ready for my first shift up here in New York.
King flew to New York to help out his beleaguered colleagues there.
It was intense, but walking into the ICUs up there was kind of mind-blowing. They had people on ventilators everywhere. The number of patients that they have on ventilators and the acuity of the patients up there was very eye-opening.
Inside the ICU at Williamson Medical Center, Samantha Queen and her colleagues saw the heartbreak of the pandemic up close.
Having to FaceTime these loved ones with their patients, with their loved ones on the vent, saying there's nothing else that we can do, so you have to tell them goodbye through this phone.
Even though she thought she was taking all the right precautions,
we were taking our temperatures twice a day. I woke up the next morning and could not, it was a Sunday, I could not taste or smell a thing.
Samantha was told she needed to get tested for COVID-19.
I immediately just started crying because I felt there was a slight fear of, what if I do get told that I have this? And then my mind starts to make me, once you hear you have it, our minds are so powerful, we immediately start feeling worse than we did.
It's been a long time since I've been anxious or nervous about going to work.
Right after he got back from his short trip to New York, Dr. King also started showing symptoms.
I've had fevers of 100, 101 for the past 3 days, and I just felt pretty weak and fatigued.
A recent report from the CDC found that at least 9,300 healthcare workers in the United States have been diagnosed with COVID-19, a number that the agency says is likely an underestimation. Tennessee, for example, doesn't even track how many healthcare workers get sick.
But there was definitely a lot of fear and anxiety at the very beginning, and then just the feeling of guilt of what did I do wrong?
You were taking every single precaution that you were supposed to take, and you still got it.
Right.
Fortunately for Samantha Queen, it never got any worse than the loss of taste and smell. She's now back at work.
Unfortunately, I'm not into the phase yet where I would know if I was going to get really sick.
Dr. King can only wait as his wife and children keep their distance.
Most people that get really sick, it occurs a week to 10 days into illness. You kind of get through this acute phase of flu-like illness and then start to develop the problems with the lungs and low oxygen levels, which hopefully is a phase that I won't enter.
And if we go back to the way we were before, if we go back to our normal everyday routines, and I'm very scared that this virus will rear its head again.
Still, these medical professionals worry about what happens next as people who have not seen the face of the virus up close attempt to get back to some sense of their normal routines.
I am 30 years old and I am very healthy. I have, no other conditions. And so this disease virus definitely does not discriminate.
It'd be hard to design a virus that is better at spreading itself, frankly.
Dr. King worries that because so much of the country was able to avoid the catastrophic scenes experienced in New York, too many people will not see the virus for what it really is.
I just think that we have to be very careful in the coming weeks with, if we go back to, holding big church meetings or jumping on party wagons on Broadway Street, then we're going to be in big trouble. And if we get in the same situation that New York's in, where we've overwhelmed our hospital system, then a lot of people are going to suffer unnecessarily.